Well, I was kind of glad I didn't have to sing to get into this place. So I'm going to try to keep turning around. Unfortunately, I'm kind of hooked up to a mic here. So anyway, my name's Bruce Fong. I am a osteopathic physician who been in practice about 20 years now. I actually went to my undergraduate here at UNR, and then I went to medical school at the College of Osteopathic Medicine in the Pacific down in Pomona, which eventually became the University of Health Sciences, Western University of Health Sciences, sorry. I did a rotating internship out in Florida, and then I did 3 years of internal medicine training in Las Vegas. So don't hold it against me. I originally came from San Francisco, but I kind of like Beverly, we ran away from the Bay Area. And so I've sort of become more of a redneck as I came along here, so in case anybody sees that. All right, so I'm hitting the right crowd. I also happen to be the the president of the Nevada Osteopathic Medical Association, which, and I'm not here on behalf of them because I didn't ask the board, but I'm speaking as an individual today. My group actually, at the beginning of this whole COVID-19 affair, we ended up, I wrote a newsletter about staying strong and taking care of patients. Don't be scared of this thing. And shortly thereafter, the governor and the State Board of Pharmacy in particular decided to, following President Trump's announcement of hydroxychloroquine becoming a game changer, there was essentially was a ban on outpatient use of hydroxychloroquine. And so my group tried to negotiate with them. And I don't know if you've ever tried to negotiate with a powerful state administrative body, but I think I have more success putting my head through the wall there. But let's not go there. People I thought were reasonable became unreasonable. And so unfortunately, my group had to retain a local attorney here by the name of Joey Gilbert, who I want to give a good shout out for. And there's a guy who really cares, because he took us on, and basically his own time, I mean, we did pay legal fees, but his own time, he never charged us. He believed in this so much that he supported us. And so I want to give a shout out to Joey for that. But in particular, we filed suit against the State Board of Pharmacy, the state, and the governor in particular. So we went back and forth, and can't say we made him reverse the rule, but when the order expired, because you can only hold it for 120 days, that order expired back on the 21st of last month. And so I think we were able to stare him down. At least we didn't blink. So I'm here today to kind of talk to you about, frankly, that I want to put the truth out there. From day one, when I started fighting this ban, I've been losing sleep. I'm going to say it with no uncertainty. People are dying just needlessly out there right now, and we need to do something about that. So I want to treat you guys like I treat my students. I want you guys to understand. So if I get long-winded, tell me to shut up. But I'm going to make this a little bit more interactive. But I want you to understand from the beginning to the end how all this kind of works. So we're going to start off by this. So does everybody know, number one, you're here for a COVID-19 talk? Okay. Anybody here just for the food? It's okay. I figured you guys were there, but that's good. We'll ask you questions later. But anyway. So as many of you know, this thing we call COVID-19, which is it's an interesting acronym because the CO means corona, and the VI is a virus, D is the disease, 19 means that we found it last year. But actually, let's go a little bit further. The actual virus designation, which these all sound kind of suspiciously military personally, but we're not going to go there. It's called SARS-CoV-2. SARS is a sudden acute respiratory syndrome, or severe acute respiratory syndrome, and then CoV-2 means coronavirus 2, because that means there must be a 1. Does anybody remember that there was a SARS outbreak back in the early 2000s? Okay. So we have to understand that we had background on how to treat things because of that one and another coronavirus. So anybody in here know what a coronavirus is?
There's a hand behind you.
Okay. Oh, okay. All right, sorry. I'm trying not to knock the camera over. Go ahead.
It's an RNA virus that's mostly found in animals.
Okay.
It takes a long time to convert to get over into humans.
Okay.
It never does. Normally we don't even pay any attention to it.
Repeat her
Okay,
answer.
I'm saying. Okay. So anyway, she's saying it was it's an RNA virus that typically is in animals, takes a long time to cross over to human beings. That's all very true, but it's also one of the more common things that human beings get for, guess what? A cold. Oh, you guys all knew that. Okay, so I'm not too boring. You guys are not asleep yet. I like this. Okay. So are you guys also aware that we probably know more about coronaviruses from virology than a lot of other things? Are you aware that coronaviruses are used in genetic research to insert genetic material from one source to another? That's very common. So when I heard that this thing started where it did, now I'm Chinese, so nobody can call me racist for this, right? I may be redneck, but you can't call me that, right? The point is that it was the first outbreak was in a place called Wuhan. Now there's a place called the Wuhan Institute of Virology. Okay, so this is a place where they experiment with viruses, including coronaviruses. The cover story so far is that this came from bats and they were researching it and somehow it got out. There were rumors that, this is kind of gross, so you guys are eating, I don't want to do this, but there were rumors that somebody said that, hey, some of the lab animals were being sold afterwards and put at the wet market, which if you guys have never had an experience at wet market, yeah, I'm all about culture, but be careful. Yeah, she has. The last time I was at a wet market, I thought that the big wagon with the little dogs in the cages was a pet shop, and when I found out what it was really for, I almost got arrested. So let's, when I try to free them. So that's the kind of experience I had. But so let's really talk about this now. So we have a virus that is called novel. So novel just simply means it's new. It has features we haven't seen before. So we knew that this thing was causing people to get really sick and die. So let's kind of talk about this and talk about it in a perspective now. So the SARS-CoV-2 itself is a virus that is primarily a respiratory virus, but about 20-25% of people actually may experience GI symptoms, pretty much like any other flu you might actually see. Okay? You guys want to take a guess as to what percentage of us actually just simply catch this and actually just simply get better without any help?
95%.
Lady says 95% back there. I'm making it like an auction. What have we here?
99.
80%. Okay, 99. I hear anything else back here?
75.
95, 75. Okay, believe it or not, the first answer was actually correct. It's about a 95% resolution rate if you, and most people, if we don't do a whole lot.
Can I ask you a question?
Yes, please.
So if the symptoms are GI with your the person's coronavirus, would the virus show up in a nasal swab?
That's a good question. So would a viral nasal swab show a positivity if you have a GI symptom? That actually is it's kind of a toss-up because normally by the time you have GI symptoms, it is trying to invade the respiratory tract. So you got a good shot at seeing it, but there's no guarantee of that. Most people actually, when they have GI symptoms, obviously they're not thinking. I mean, how many was that a surprise to you guys when I said that was a GI thing? Did you guys? Yeah, so a lot of people didn't know that. So what happens is they wouldn't necessarily go seek. They probably said, you know, I ate at. Who's your competition here? So we'll say, well, I ate at so-and-so's restaurant the other night. Okay, and you know, so I think I might have said something wrong. They don't think corona at that point or the SARS-CoV-2. So at that point, they go through that, and the typical story is they go through that, and the respiratory symptoms typically start about 3 to 5 days later, and so which is probably the normal incubation period. Okay, so at that point, most people get they're being referred out, and the most of the recommendations most doctors will tell you right now is that you think you got it, or you know you had it, or you had a positive result. What's the normal answer most doctors would tell you? Stay home. That's right. So, okay, right, exactly. So just really supportive therapies. You don't really do a whole lot. And now here's the part where I think we made a mistake. Everywhere else in the world, we were looking at patients and following them a little bit closer, and if they started getting worse, we would actually treat earlier. For some reason here in the United States, the standard of care became completely hospital focused. That if you got beyond a certain point, that they would admit you to the hospital. And admittedly, we didn't do a very good job with folks at the hospital for a long time. We've learned a lot now, and I think that my hospital brethren, they're doing a great job now. But our traditional methodologies taking care of people were not really good. So let me explain why that is. So let's ask another question. Who here knows that coronavirus is probably more than just what we just mentioned, a respiratory virus? Who knows that it probably has more than one stage? Is that a surprise to anybody here? Okay, so I'm glad you guys get that, because I can't get some doctors to understand that. Okay, so what do we mean by that? So we said 95% approximately, and if I had prizes, I'd give you one, because that was really good, by the way. So the bottom line is that if 95% of us get better on the most part without any intervention, we still have a significant number in the population that are going to need intervention, okay? But why is there a difference between who gets better on their own and who doesn't? Okay, comorbidities, everybody's saying these. Comorbidities. So I'm actually going to focus on your answer about immunity, okay? Because what happens in people who get worse is that their immune system basically freaks out. We have what's called a cytokine storm. What does that mean? It means that your immune system, for one reason or another, and we'll get into comorbidities in a second, is interpreting that you're overwhelmed. Like too much viral involvement in the cells, possibly secondary bacterial infections. So let me use an analogy to describe this. Anybody here in the military? Okay. Anybody been actually in combat before or anything? Okay, you know that. I don't want to bring up old bad memories, but
It's okay.
okay. So we'll kind of say there's a guy sitting there with a machine gun watching a pass. Okay, so it sounds like he's done this. So this is a good interview. Okay. So you see one or two guys come up, no problem. You take them out. What happens when 1,000 guys come rushing through that pass? So it's called, and she did perfect. Can you do that again for me? Yeah, exactly. She's doing well. I mean, there's an expression we call spray and pray. Okay, so you basically hold down the trigger and you don't care. You're going to fire everything you have because you feel like you're about to get overrun. You're going to be overruled. That's what the immune system gets signals for. And the immune system freaks out and it basically dumps everything into play. In particular, there's things called cytokines which induce inflammation in the body. In particular, things like interleukin 1 and 6 are the ones that are normally named. And at that point, just like the guy who's spraying and praying, you don't care where your bullets are going. You're trying to hit everything you can and try to change the situation. That, unfortunately, is where you're going to actually damage your body more likely. I'm trying to make eye contact with all you guys. I'm sorry. I'm just... So the bottom line is, when you're doing that, that's what ends up making people so sick they've got to go to the hospital. That's what's creating inflammation in the body, creating a situation where your body is not able to handle it and you start damaging your own tissues. That is what we call the cytokine storm. Okay, that's the latter part of this disease. So, can you? Does it make sense that if you treat one side of this thing, if you're just treating basically a virus that might be getting worse, but you haven't entered this stage specifically yet, that it's very different than you're actually in this inflammatory state? Does everybody get that? This is really important to understand because I'm going to explain a lot of different things through this. Now, a bunch of you guys mentioned comorbidities. So basically, these mean that you have either you've got age apparently not on your side. Okay, sorry. You look good, but if you're actually over the age of I think they're saying 60 is the cutoff. But no matter how good you look, supposedly because in my theory on this is your body has been exposed to a lot at this point. That immune system might get kicked off a little harder, a little easier. if you have other things like pre-existing lung conditions, obviously, if the inflammation starts there, it's going to be a problem, or other organs. There's also a thing where people make clots, break up clots rapidly, and that actually causes all kinds of problems that way. So the long and short of it is, the more your body has gone through, the more likely you're going to have a problem in this particular arena. So far, follow me? Yep. Okay. So with that being said, let's talk about why there's a big difference in treating things, because let me take that back. How many of in here have actually heard of hydroxychloroquine? Okay, so that was kind of a dumb question. I think you all came because of that topic, right? Okay. All right, so you all knew about that. You guys all know it first came out in the 1940s, treating malaria, and it's been extremely successful in malaria since then. People around the world use it for prophylaxis, which we'll also talk about. And I'm going to take this opportunity to point out one of my mentors, Dr. Forsyth with the white hat right there. He actually was you were a major back then, or a colonel still? Major. Okay. He was the major in charge of the Southeast Asian theater of operations in the Vietnam War for, specifically, so he was the one that's in charge of malaria abatement. So he had labs set up. He was in charge of treating and prophylaxing over 500,000 soldiers. And he can tell you right now, he's seen very few side effects with the medication. So I want to point that out, but he's just an awesome guy. And anyway, I got to say that because he was my first mentor. So, but I love you, Jim. So. Okay, so the question is, does age affect your, the side effect profile, right, of hydroxychloroquine? And the answer is there's a possibility of that, but it's really more due to the amount of time you take the medicine. Because since then, we've actually, in the last couple of decades, we've started using it for rheumatologic conditions like lupus, like rheumatoid arthritis, and those patients are on every day. Then we're starting to see other long-term, if you want to call them toxicity-based reactions, things in the eyes. This thing that's infamous now that everybody keeps mentioning is a QT prolongation. So QT prolongations are these electrical abnormalities in your heart. You make your heart too slow, there's another part of your heart that's going to try to kick it into overdrive to make up for it. And unfortunately, when it does that, anybody been to hot August nights and nobody knows what they're doing with their engine? That's basically what's going to happen. It's going to go out of control, and your heart could actually go into a fatal arrhythmia. Okay? We knew about these things, but there's such a small percentage of people that get it who take it on a regular basis. The lupus folks, the rheumatoid arthritis folks. Okay, you're on it. Oh, you're on it. Okay. That we and like any good doctor should tell you about the side effects first, but also tell you that the chances of having that side effect are extremely low based on your case. I'm making a point about this because eventually, this is all about me being your doctor and you being my patient. It's whatever we decide, that's sacred. Nobody should interfere with that. That's why we sued the state, by the way. So, okay, thank you. So anyway, let's get back on track here. But the hydroxychloroquine, back in 2003, when that first SARS thing hit, it actually was shown to be really effective. In fact, guess what? It was so effective that a certain doctor everybody's heard about.
Forsyth.
Well, it wasn't Forsyth, but it's actually, certain Dr. Fauci said it was probably the most effective medicine for the SARS-CoV-1. Well, we didn't call it 1 then, we just called it SARS-CoV. Okay?
Grouchy Fauci.
Grouchy Fauci, we like that one. So you're asking me to repeat everything, so I'm going to repeat all that. No. Yeah, so don't say anything you're going to make me repeat, okay? So anyway, so the bottom line was we got over that one. So now we got this one going on. And since March, when this thing first came out, I've been really kind of following it, as you can tell. And what I'm going to tell you is that, what everybody else around the world seems to be doing, and we're not doing, is trying to treat it earlier if we need to. So I coined this term that I don't think a lot of people use, but I call it a critical therapeutic window. Critical therapeutic window to me means you get it, and you give yourself a couple of days to see if you're going to get better or worse, but if you really are starting to significantly get worse, we need to treat you. If you're not getting better after 3 to 5 days, probably should treat you. If you have, here we go again, the comorbidities, the other things that put you at risk for things, we should treat you. But who should make that decision?
Doctor.
Well, you and me as well, you guys are going to be my patient, I'm sorry. But hopefully you'll be my patient. But anyway, if we talk about this, and we talk about like I'm talking to you now, I try to talk to my patients like this all the time, to try to educate them. If we make a mutual decision, that's our decision. Nobody should interfere with it. And so the bottom line is, I wrote a newsletter about this in March, and right after the ban was going in place. And since then, you know, people have questioned me about, hey, where's your research that says this and that? Well, I can tell you that there's lots of research from around the world. I actually have a website on my phone somewhere there. I don't think I can reach it, but we'll go there. There's a website that actually kind of lists almost every study that's out there. Now, one of the biggest criticisms about a lot of the studies that have been favorable towards hydroxychloroquine is that they're not what we call controlled trials. They're not really, you know, hardcore things that, that we do here in our academic settings. So if I look at this, I'm sorry for all the military analogies, but if we're getting blindsided by an enemy right now, I'm not going to wait for some hardcore long-term study. I'm going to take what I see that works from wherever I can find it, and I'm going to try to treat patients. That's what a lot of doctors are trying to do. And then, like I said, back in March when Trump made that announcement saying, hey, this is a game changer, let's face it, a lot of it was political. Many states, including our own, like 6 other states besides Nevada, decided to try to ban the stuff. Within about 30 days, I would say most of the other states, they lifted the bans. They knew that was a bad idea. So I was getting into that. I'm sorry, I got so much I want to say. I'm trying to condense this down. But the bottom line is there's a lot of this research, but then all of a sudden we're getting this research coming out that says it's bad. It doesn't work. It's going to increase the QT prolongation or the fatal heart arrhythmias. But do you guys know that almost every one of those studies was done on the sickest of the sick people, the ones in the inflammatory state? So, dumb question, but let's see how everybody answers. And I'm not going to call you dumb, I'm sorry. But the bottom line is, who's more likely to have a medication reaction? A person in relatively good health, or the one that's going, basically spinning the drain there? Yeah, okay. I mean, if you're in a cytokine storm, if you're highly inflammatory, and your body is shutting down because of it, you're going to have all kinds of reactions you wouldn't normally have. So that's number one. Number two, what I described to you earlier, when you're in that cytokine storm, you're in an inflammatory state. Yeah, a recent study, which was a good study by the Henry Ford Health System in Detroit, showed hydroxychloroquine in that hospitalized setting where somebody was in the inflammatory state and treating the inflammation was actually helpful in reducing deaths by 30%. Just right off the bat like that. And then there's another factor we're going to talk about later. It's about zinc. A lot of the studies that poo-pooed hydroxychloroquine didn't use zinc. And I'll explain why that's important in a few minutes. But are you guys also aware that there were several studies that were very damning to hydroxychloroquine that were actually retracted because the data could not be verified?
Yep.
Okay, so, you know, I've never tried to be political about anything, but there is definitely a conspiracy to make this medicine look bad. Whether it's political or somebody's trying to push another medicine that costs over $1,200 a dose, which I won't get out there. I don't want to get shot today. But anyway, but the bottom line is the hydroxychloroquine, when used in the correct settings, and what I mentioned earlier, this critical therapeutic window before somebody goes to the hospital. And so let's talk about what you need to do. You got to use hydroxychloroquine and zinc. The two things are real important. I'll explain that in a second. Also azithromycin. But if you treat people at that critical therapeutic wing, or just frankly earlier, you can have close to a 98% cure rate. And basically, you keep everybody away from the hospital just about at that point. And we're talking about the sick people, the at-risk people. Yes?
Does the formulation of zinc matter?
So the question is, does the formulation of zinc matter? So the study that President Trump touted, and the one that a lot of us are going back on, it talks about zinc sulfate 100 milligrams twice a day. My personal experience is that I think there are more absorbable forms of zinc, gluconate, glycinate, for instance, and I think they work just as well, if not better, at smaller doses. But there's no specific study to look at those, but I could tell you that you could take those just as easily. Zinc is zinc, and the more you can get in your body, the better off you're going to be. Okay, so let's kind of chat about this a little bit. This protocol, this trifecta that my pharmacy buddy and I kind of coined that term. It talks about hydroxychloroquine, and you would take, they come in 200 milligram tablets. So you take 2 of them in the morning, 2 of them in the evening on the first day, and then 1 in the morning, 1 in the evening for 4 more days. So it's 5 days. And then that's in combination with zinc, again, 100 milligrams twice a day while we're doing this. And you can keep taking zinc before and after this. It's a great prophylaxis, by the way. Then we give azithromycin. So I was actually talking to an anesthesiology buddy of mine this morning. The azithromycin, in most understanding, is to try to knock down that secondary bacterial infection that could come in, or other infections that can come in that make that immune system feel like it's getting overwhelmed. But there is evidence suggesting that azithromycin, which is a macrolide antibiotic, also known as a antibacterial, has antiviral properties. So each of these has its own effect. Now, hydroxychloroquine, the mechanism of action is that we mentioned it's an anti-malarial, anti-parasitic medication, right? So one of the most important things you got to do with stopping parasites is what? Keep them from coming into your cells. So there's research out that shows that hydroxychloroquine, and I'm going to try to keep this simple, it actually alkalizes, makes less acidic the membranes of your cells. So even if the SARS-CoV-2 virus plugs into what's called an ACE2 receptor, the transport proteins which take it from one side of the membrane to the other, because of the altered pH, are shut off, essentially, or at least downgraded. So there's less and less stuff that can get across into the proper part of your cell. So in case you guys don't understand how viruses work, they penetrate your cells, they go through the cytoplasm, they go to your nucleus, and they basically take over the nucleus of your cell to make more virus. And so that in effect, store your cells that way to reproduce themselves. So if we stop them in the membrane, it's not going to cause that damage. It also does not trigger the response that gets the whole immune system to freak out. Hydroxychloroquine now traps it there. It's starting to kill it because it does have an antiviral property as well. But here's the cool part, and this is where zinc comes in. Who's aware that zinc is probably one of the most potent antivirals in the world in regards to the natural things? Okay, so you got, I got to throw her something. I mean, I don't know. You want some nachos or something? I'm sorry.
First sign of a cold or a sniffly nose or a headache or something like that, I take zinc. Sometimes I take nasal, easy, a cold ease.
Right.
I have zinc in my diet.
Yeah, zinc's been very well established as a preventative and an early stage viral counteragent. What's cool about the combination of hydroxychloroquine and zinc is that hydroxychloroquine starts a channel that actually sucks up zinc into the cell a lot faster. So you're putting more zinc in there. So, like you said, when you were facing the 1,000 guys coming through the pass, guess what? Here's your artillery coming you were asking for. Here's the reinforcements you were asking they're coming for. Because now you got the stupid virus in a crossfire. You've got 2 things trying to kill it. You've trapped it where it can't hurt you. And you're going to eliminate it really fast. So I can tell you that quite a few people I've treated with the hydroxychloroquine, azithromycin, and zinc combinations, quite a few of them I've treated where they were really sick, and these were people with typically asthma or COPD things, and I didn't want to see them go to the hospital, so I treated them. Within 24 hours, they were their lung symptoms went away. They might still have a fever or something, but it was pretty miraculous. It would turn them around to the point where, dude, what the heck did you do to me? And can I get more? Okay, that's about it. Okay. Let's get more, right? So the bottom line is that combination, if used, and this is the critical part, used at the proper time, has to be the way to keep people from getting hospitalized. Oh, I'm already there. I'm sorry. That's when I get.
So are you saying that it changes the pH in your body so it doesn't go across the cell membrane?
Okay, so the question is, does it change the pH in the body? No. It changes the pH specifically at the cells in the membrane so that the transport proteins don't work.
Gotcha.
Yes.
Okay.
As a physician, you're using 2 drugs off-label. azithromycin and the ACQ. What's your liability level in terms of the FDA's conditional licensing for these?
Okay, so the whole point, the question is using medications off-label, what is my liability as a physician? Actually, there isn't a liability because physicians every single day can use any medication for off-label purposes as long as you explain it to your patient. Well, hopefully they explain it to your patients. But that has always been the case. I'm trying to think of sildenafil, which at one point was used for hair loss. Wasn't very good for that, but guess what sildenafil actually does? Okay, he knows what it is. It's Viagra. Okay, so totally off-label use because somebody observed a side effect, and now we're going to remarket it. Some of the antidepressants we rebranded because they sucked as antidepressants, but they worked great to help you stop smoking. Okay, so those are so that the answer is that it happens all the time, and nobody, unless you're hurting somebody or you get reported to the FDA and they have come investigate, they have to give you a cease and desist and all that kind of stuff. What's that?
Aspirin.
Yeah, aspirin. I mean, there's tons of things we do for aspirin. I mean, aspirin. In the old. I'm sorry, I hate using that term. In the old days, we just used it for fevers and pain, but now we're using it to prevent heart attacks because we know about all the other things. But I actually, do you mind if I take him first? You had Sandra first. Yes, sir.
Does this regimen of treatment suppress the development of antibodies or T-cell action?
So the question is, does this?
Are you still able to get more?
So the question is, does this triple treatment suppress the ability for an immune response that's proper? By definition, once you've gotten the virus, you already are generating an immune response. We're actually trying to keep it from going out of hand. But the answer is yes, and unfortunately, there are times where sometimes we could, as doctors, may give you an antibiotic. I've never done this personally, to get you out of my office or something, but just because you're complaining, but no. We sometimes do treat things too much, that is admittedly the answer, but and in those cases, you may not develop an immunity, but probably in this case, because of how quickly the virus replicates, you probably are going to be generating immunity fairly quickly to it. Whether and how effective that immunity is a big question mark. We don't have any good research on that. There was a case this week that they announced that a guy in China apparently has now contracted it twice. I'm not sure if, again, so you guys know, don't believe everything you read, right? Realize that there's other factors. We don't know if this guy has some kind of immune problem or if he has other issues. Maybe his immune system doesn't work the right way, so we got to be careful without generalities. So let me take her question, and I'm going to get dizzy doing this. Okay.
One, how can it be off-label if it was considered the treatment for SARS? One, that doesn't make any sense to me, and it was over-the-counter in multiple countries for anti-malaria, which is still a blood virus. So I don't.
Okay. So the question is, how is this off-label if it was one of the treatments of choice for SARS, the first SARS virus, and it's used over the counter in other places? That's kind of a multiple question, but when we say labels, say if I grab my phone, I have a drug guide in there. It says indications for this, and then by the indications, there's sometimes specific dosing for certain medications. So those are actually FDA-approved indications. That's what I think that refers to, because there was never an official indication given to, although it was really effective, it was never given to this for the SARS.
Then a second part question: how come we're not hearing more about how to increase your immunity just in general? I feel like the message is always mask versus vegetables, rest, exercise.
So the question is, why are we not talking about increasing immunity more? Well, right now, a lot of times when you're, in this case, the zinc probably works with your immune system, number one. But number two, really, when you have something that could rapidly diminish somebody really quickly and push them, to a point where they could die, sometimes you got to get a little bit more aggressive with it. So that's kind of part of what we're dealing with. As we understand the virus more and more, I'm going to step out on this because I don't have any proof of this, but frankly, I think that if you get it, I would say almost all of us would never get it again. It's kind of be like the flu, but when it mutates enough, we could actually get it again because the outside of the viral particle is going to change. Okay, go ahead.
Speaking of mutation, that could be the fellow that got it twice. It could have mutated. He could have gotten another round of it. But my question is, how confident are you about a vaccine? Because I am not at all. Because it will mutate. That's why we don't have a vaccine for the cold or AIDS or anything else.
Okay, so the question is, how confident am I on the vaccine? You remember what I said earlier, that we probably understand this virus better than a lot of other viruses? The only way I think that some of these vaccines can be quote unquote called foolproof is because this is being recorded, right? I think honestly, I think this virus was engineered. It was altered.
Yes.
Okay. This was probably somebody's, and having had dealings with the Communist Party in China in the past, that wasn't even directly with me. I can tell you that they're not very nice and not very honest people. Okay. And this Wuhan Institute of Virology is known to be working with, it's the only civilian program working with the Chinese People's Republic Army's Biologic Weapons Division. So could it have been part of that? Absolutely. And we're going to talk about that a little bit later too, about the second spike we saw, because I have some comments to make about that. But to answer your, okay.
Your presentation.
It's okay. I want to make it interactive. It's okay. So, but the bottom line is, am I confident with the vaccine? Probably not, because influenza vaccines, I think, is one you brought up.
Yep.
So everybody, I want you to think about, there's a, they don't look like this, but imagine the letter Y. So you have your two arms. I can't do this with a mic here. Hold on. Two arms, and you got your body. Okay. The body part is what's called a constant. This is how we teach students. But the body part is called the constant region of a virus. It doesn't change. The arms are the parts that actually are variable. Those are the parts that can change. I think I moved the camera, I'm sorry. Anyway, those are the parts that can change, and those are the parts that unfortunately we can only make vaccines to right now. The holy grail of vaccinations would be if you could actually get a vaccine to the constant region of any virus. If you did that, you'd eliminate that virus from ever being a problem anymore. So we haven't been able to do it for influenza, and influenza has been around as long as people have been around. How are we going to do it with corona? I don't know. Maybe because you made it? I mean, sorry. I shouldn't say that, right? That's that. But that's my personal opinion. And would I trust the vaccine? I would say my opinion is with the article I read today that everybody's rushing to do this. The answer is not just no, but hell no. So that would be. And I'm sorry, I got somebody. I'm sorry. Go ahead.
My understanding is that zinc is sequestered in your liver. So do we have to take a blood test to find out what our zinc levels are, or is zinc considered non-toxic?
Zinc itself, actually, your body. I'm sorry. The question is, can zinc be toxic? The answer really is that your body, because it's a mineral, it would actually get controlled by your normal mechanisms, primarily in the kidney. If you have excess, you'll probably dump it out.
But
So
if it's sequestered in the liver, wouldn't that be used first? Or
it kind of depends on what situations are, because certain situations in the body can sequester the release of the zinc, but other situations would not. But on the most part, I would tell you that zinc's kind of considered mostly a trace mineral. I mean, you don't have a lot of it in your body to begin with. So the answer really is that sequestration, storage of zinc, it's probably not a significant part of what needs to happen. Mostly what you take. And so I can tell you guys, my prophylaxis since March is 3,000 milligrams of vitamin C twice a day in a liposomal form. I will take zinc. I probably take way too much of it. I take about 100 milligrams twice a day. That's a treatment dose. You probably don't need to do that. But I have not had any problems. As long as I drink enough, I pee fine. I'm sorry. That's way too much information. But the bottom line is that it's very safe. All these things come out of your body. There's no real reason to worry about toxicity.
Okay, I thought with the zinc that zinc would lower copper in your body and vice versa. Like if you have too much copper, it would lower zinc and too much.
So the question is, there's a balance between zinc and copper. And would you really throw off the balance? Probably if you do something crazy like me, yeah. But again, copper is very much a trace element. So again, you're talking about things that have such minute amounts in your body that altering them, you're probably not going to feel any major issues, at least never right away. But you know, it wouldn't hurt to check levels of those things on occasion just to be sure. But everybody's pretty different because the main control organ for a lot of these would be the kidney.
Doctor?
Okay, and also there's a patent on this virus, supposedly, COVID-19,
Okay.
patent 060606.
So she's relaying that there's a patent on this specific virus
Yeah,
and
COVID-19.
on COVID-19, and so go
Yeah,
ahead.
060606, and the company that worked on it is funded by Bill Gates. Just
So again,
thought everyone should know.
she had a comment that the company that funds this is Bill Gates, and by the way, Bill and Melinda Gates contribute very highly to a number of these vaccine companies too. So I just want to put it out there. So go ahead, Beck. Okay, so the question is, do I anticipate this will run its course? And I'm so glad you asked that question because it's going to get us right back on track where I wanted to go. So, okay, so everybody, do you realize that every single country that's gone through this has run a specific course? You see a sudden spike in deaths. It actually disappears fairly quickly, and very quickly the virus seems to go away almost. We did that, except we suddenly had a second spike. Okay, other than the 20-something-olds, we don't have any here, right? Okay. Other than the 20-something-olds who wanted to swap spit, I'm sorry, I'm totally sorry, who couldn't help themselves, but they wanted to go hang out with somebody, let's put it that way. They have very mild illnesses because, you know, frankly, I'm going to tell you that this virus, if it was engineered, think about this. What's a perfect biologic weapon? It doesn't kill everybody. It causes what it just did to us. It kills a certain number of people, makes everybody else freak out, it shuts down everything else. But after a while, you want it to not be so virulent because then I can roll in here with my army and take you over. So if you think about it, why did every single country follow this pattern? So that's some evidence on the side, and I know I'm getting recorded, whatever. Like I said, I'm not specifically representing anybody, these are my opinions. Now, why we had a more deadly second spike? Places south of the border, Mexico, Central America, and South America, I actually have patients all there. They didn't get hit with COVID until 3 months after we did. So it's following a timeline, but they're following a timeline that's 3 months behind us. So when people were going back and forth across the borders, they actually contracted the more live or more virulent part of the virus, bringing it back, and that was starting to spread. If you look at the major hotspots where people were dying over the last couple of weeks, you'll notice that the one huge epicenter was Dade County in Florida, which is Miami. Anybody been there? Okay. You guys notice that's probably like probably like a little Cuba, right? So everybody there is Hispanic, but it's not that there's a ethnic preponderance, but it's because people have visited. And almost all the cases in Florida are confined to Dade County, and the spillover into Broward and the associated counties, and I think I said to you earlier, I did some training out there, so I know the area. They were all overflow from Dade. Okay, Houston, same situation. Las Vegas. Now, I won't say who told me this, but I have quite a few friends where I trained at down there in Vegas who still are in the area. They told me 95% of the ICU beds were occupied by folks from Mexico, and they were all from North Las Vegas. So they were in a kind of a common place where they got it. Pretty much in California, until you get down to LA County or south, you don't see a whole lot of it. And so each one of these is lending credence to, now this, and I don't know why nobody else is identifying this. I simply happen to have patients who are down there telling me how bad it is, and I put 2 and 2 together. Hopefully I'm adding up to 4. But that's kind of my theory right now, is that you have something that was running its course in a different time pace than we were. That's why we have a secondary spike that we do now. But direct answer to your question, by all means, this is going to go away. As the Bible would say, this too shall pass. Okay? So, yes, sir.
I think you mentioned that one of the things you do besides taking zinc is taking 3,000 IU units or something of
Milligrams of vitamin C.
Milligrams.
Yes.
Vitamin C. I thought that vitamin D was more important than taking vitamin C.
Okay, so the question is why am I taking vitamin C as opposed to vitamin D? Well, vitamin C and zinc I can use prophylactically, that if I did contract the virus, it would help to be in larger proportions in my bloodstream to kind of try to help knock out the virus. Vitamin D is a modulator of your immune system, so it's one of those things that keeps you from going into that cytokine storm. But it's important. Vitamin D, in recent times, endocrinologic-wise, we're the world of medicine and clinical medicine, laboratory and clinical medicine, is actually, there's a move to make vitamin D a hormone because it has such wide-ranging effects on the body. But but direct answer to your question is that vitamin D is more of an immune modulator, so we don't go into that cytokine storm that tends to kill people.
You mentioned that you take liposomal vitamin C. Is that marketed as ester C?
So the question was, is ester C liposomal? Not necessarily. The liposomal vitamin C's put the vitamin C in. I'm losing my mic here. Am I there? Okay, there we go. Anyway.
Yeah, we're gonna give you a different mic.
Okay. I'm gonna lip sync around. Hey, so my name is Bruce, so I can play like the Bruce Lee movies. I'm gonna get you. No, I'm sorry. Okay, so I'm sorry. Okay, so bad jokes aside, this one works now. Liposomals mean that whatever compound you're taking liposomally is essentially a lipid base. Why that's important is it allows rapid assimilation in the body. So I use that in the vitamin C forms. Ester C isn't necessarily that unless they put it into the oil base. I'm sorry, did you have another question?
No, I mean, I thought that what I had heard before was that vitamin D and zinc were more important than taking C and zinc.
Okay, so again, I've always used vitamin C to keep me healthy. There are studies that show that it helps to reduce the transmission of and infection with a common cold and other viruses. That's why I'm using it for a prophylactic reason. But I certainly wouldn't say don't take D. I would say go ahead and take the D because you need it for a lot of things. But in regards to preventing the virus from getting into your system and getting a foothold, I still, my opinion would be C and zinc first. Okay. I'm sorry, let me take
Really quickly, it's my understanding that you can OD on D.
So the question is, can you,
C,
yeah.
you eliminate immediately.
Okay, so the question is, vitamin D, can you overdose? Absolutely. That's why we always, being a fat-soluble vitamin, it can get built up in your body, and by definition, it can become toxic. But the bottom line is that, if you guys are taking it, at some point, ask your doctor maybe to check your lab on it on occasion, just to be sure. But, it's not good to be low, but it's not good to be too high either. So, did you have another comment, sir? Okay. All right.
Just one more about
Okay,
vitamin D. Would you, to prevent the cytokine storm, would you need more than having produced in your body naturally by just being outside, or?
So it's a kind of an interesting question. Should we be taking more vitamin D to mitigate a possible cytokine storm? And you mentioned being outside and in sunshine. So, so without getting into a long lecture, because students want all these details, but you take vitamin D, it actually goes through your liver, you convert it to 1-hydroxy vitamin D, and then through sunshine in the kidney, you actually convert it into the active form, which is 1,25-dihydroxy vitamin D. So the more sun you get, whatever you have in your body gets more and more converted into a more active form. So again, you got to be careful about taking too much of it simply because of what we just mentioned. But at the same time, you got to have enough that you can convert when you need it. Was that good?
Well, yes, but a typical daily multivitamin has probably that much.
It depends on which. Okay, so the question about multivitamins is that you got to really look at your label. And I personally wouldn't, on my patients, I'd probably check you before I'd start to get an idea of where you're at before I would arbitrarily say 2,000 or 3,000 IUs, which is the most common dose on a regular day.
So what's too much?
So the question is, how much is too much? Again, the answer really is it's kind of depending on your body. It's like where you start from. because you would potentially use up vitamin D. So you know, what we teach students whenever there's something that's low in the body, you're either not getting enough of it, you're not making enough of it, or you're getting rid of it too quickly. Okay? So all these factors play with just about anything. So in the case of vitamin D, most of the times you're not making enough of it. And so you might have to supplement it. You might not be getting enough sunshine, so you're not converting it from one form to the active form. Or there are processes in the body, for whatever reason, that can get triggered to overly get rid of it from your system. So the bottom line is, if you really want to be safe, get a level check before you start. Jim.
One thing I want to mention, and I've recently, on my radio show, Health Matters, which is on every Wednesday at 3, and Bruce is often on the program, just a plug-in for that. But the mortality rate is really the most important thing. That's the number of deaths over the confirmed cases. And right now, at 175,000 deaths in the U.S., over 5.3 million confirmed cases, the mortality rate is 0.033. That means 1/3 of 1%, less than we get from every year's flu epidemics.
Absolutely.
And the world mortality rate is almost exactly the same right now. Washoe County is 0.019, so 1/5 of 1%. Remember that. So children go to school.
See, when he was my attending, he made me memorize all these numbers like that. I can't do that anymore, but anyway, we're not going to go there. Thanks, Jim. So that actually does bring up the other point. When you see all these panic headlines saying, oh, no, all these deaths happened in this one day, it's really important that you understand what Jim is saying here. I've been saying since March, because we had really sucky testing. We probably don't have very good testing still, by the way. But the bottom line is that before we had testing, people, as we said, we were being sent home if you thought you had it. So the only confirmed cases were the ones who were sick enough to go to the hospital and get tested eventually. So at that point, it makes it look like the death rate, meaning the number of deaths to the so-called total number of cases. That's not true. You have so many people out there. In fact, we think 20% of people who are out there probably have this. They don't even know they have it. Who likes wearing a mask? Oh, I'm so happy to be in this crowd. I can't stand the mask. But anyway, if I go and I'm doing a procedure in the hospital, that's one thing. I stand there, I gotta change my mask in an hour because it starts to sweat and it gets uncomfortable. Going out in the heat and smoke with it? Oh man, I have one of these cloth ones that has a breathing hole. I don't care what they say. But it's really interesting at this point is I want you guys to, I'm just gonna give you guys information about this. Who's heard of an N95? Okay. Do you guys know what N95s were created for?
Construction.
Well, yeah, that, and we actually in the medical world, we used them for TB because they were a little smaller than normal bacteria. So they would stop it. N95 means 95% effectiveness at 0.3 microns. To give you an idea how small a micron is, 1 micron is the diameter of a typical red blood cell. So an N95 can filter out 1/3 or a little bit less than 1/3 of the size of a red blood cell. Anybody want to take a gander at how big this virus is? So it's about half the size of that. Okay, so it's what do we say? It's 0.15 or something like that. It's probably less than that. I think what I read was 0.08 to 0.16 micrometers or microns. So frankly, it's really not gonna stop something coming through. Now the argument is that you're wearing this so that you don't put it on somebody else. I'll kind of buy that to a certain degree, but I was actually lecturing on this stuff, by the way, I forgot to mention, back in March. Tried to help people not to be scared of it and keep moving forward. I also happen to be the medical director of a small county's fire department, and again, I didn't ask the permission, so I won't say what counties. I'm the medical director of their ambulance service, and we're going to talk about prophylaxis in a minute because I've been hit over and over again about that. But the long and short of it, what did we teach people back in March? Was it important to wear a mask or to wash your hands?
No.
Wash your hands. Why is that? Okay, so what are we worried about when somebody coughs? Let me put it that way. Droplets. That's the term I'm looking for. So I want you guys to think of a droplet. So here comes the redneck coming out of me. So the droplets are like a shotgun shell. When it first comes out, it comes out in a big wad. As it spreads out, then individual particles, some of the individual viral particles can hang in the air. Most of it, if it's stuck in a drop, is going to end up on a surface. I was going to mess with you guys, make you rub the table, and then say, don't touch your eye. Don't do that. But if you think about it, you touch the table, somebody happened to cough or somehow put something on there, that's a concentrated dose. I suck in one out of the air. Guess what? That's one little pellet. It's like shooting at something with the tiniest of the birdshot and just pissing it off. Okay? I mean, it's not going to, my immune system's probably going to knock out one single viral particle. So in medicine, we always talk about that there's a minimal amount that you have to get into your body to let an infection get settled. In other words, a minimal amount to infect. Breathing in a single particle probably isn't going to do that. Okay? Now, if you breathe in, you happen to get there where somebody just went bleh, like that, and it's all over the air, yeah, you're probably going to be at risk. But then again, the mask isn't going to stop it. That's the problem. So, as a Christian, I'm losing you again. Okay. Okay, there it goes. As a Christian, I read in Romans 13 that, you know, God put everybody in authority for a reason. So I do respect the law. I'll wear the mask. I don't like doing it. I don't believe in the mask, but I do it because it is what the law is stating. But I think we all do that. And then, of course, we take it off as soon as we can. But, yeah. The bottom line, though, is that...
I have new batteries.
Okay. The bottom line, though, is I just want to give you the facts about the actual true effectiveness of masks. And the whole thing was nobody thought this thing really was airborne until the University of Omaha, Nebraska study. They actually took, and I actually was out there at one point during my medical training. Their facility is pretty modern. They actually have reverse isolation, meaning that all the air gets sucked into a room, in a lot of their rooms, not just a few. But they decided to go around and take air samples, and they actually grew the virus out in the hallway. So unfortunately, does that mean it's really airborne, or did that mean that somebody just went by there just recently? And it's kind of hard to say, but kind of based on that, we start changing our opinion, and everybody supposedly had to wear masks and social distance, and now we're getting conflicting stuff from, and you're going to love this one now. President Trump has asked us to withdraw from the World Health, which I don't think is a bad idea, but you know, you don't want everybody dictating to the same policy or whatever, but because everybody's different, right? So the whole point, though, is now it seems like the WHO is saying the same stuff that we're all thinking. The WHO was actually at one point about 6 weeks ago saying the only people that need to wear a mask were healthcare workers taking care of COVID patients. Now, my opinion is, I personally, and the WHO is just about to say this, they're not quite willing to do it yet. They're about to say that the only people that can affect somebody else is somebody who's actively sick. So let's think about that. We mentioned earlier, what's a coronavirus? It's the most common cold virus. So there's a chance somebody who isn't symptomatic with a cold could infect you, but it's not really likely. It's not likely, right? So we got to think the same way with this, and World Health isn't quite willing to say it, but their data is really suggesting that they're just about 99% sure that unless you're actually actively symptomatic, you're probably not going to have a big chance of spreading this thing. So at that point, who's really needing to wear the mask? Yeah, but again, I'm putting that out there to you, but I'm not telling you not to wear masks because I don't want you getting in trouble. You guys seem like really cool folks, so I don't want you. What about the children? Actually, it's good that you asked that because there's a new study showing basically kids are not, they're very rarely going to ever have serious symptoms. Their immune systems, on the most part, are developing still. So I'll give you an example of another virus, chickenpox. Okay, as a kid, when I was a kid, they stuck me in a room with a whole bunch of people to make sure I got chickenpox. Anybody else do that?
Yeah.
Okay, so I must be betraying my age because somebody's like going, what? Anyway, the bottom line is that, you know, we had, back then we had parties because as a kid, your immune system acts a different way than when you act as an adult. As an adult, if you get chickenpox, there's about a 25% chance you're going to end up in my ICU with a tube down your throat. Okay, that's a viral pneumonia that gets out of hand. So we don't have that as kids. In the new studies that are coming out looking at kids, there's such a small percentage of kids that actually even get to the point of even needing hospitalization. It's almost not worth mentioning. And so the bottom line is, it seems like kids just don't have a very serious thing with it. They might have just the sniffles. And so we want to be aware of that. And just to say, normally we're trying to protect the kids and the, if we say, I'm sorry, I don't want to come out the wrong way, but the elderly in our population when it comes to influenzas and things like that. In this particular case, it's really more the folks who are over 60, have comorbidities, and all the other things I mentioned earlier. So, okay,
Don't keep them out of school.
that's right. Yes.
Is it true that when people die with coronavirus, their death certificate reads that they died of coronavirus? And is it also true that the more these deaths hospitals have, the more government money they get?
So I might have to. Right.
That battery's in.
Hello? Okay, here we go. At some point, I'm going to end up singing with this, aren't I? Yeah, I'm like, it's so come on, it's the Asian, and we do karaoke. No, I'm not gonna. So the question really was, is there something weird going on with what people put down as causes of death these days? And the answer is absolutely yes. I've had personal experiences where a patient went into the hospital and they were basically dying of a heart attack, and they passed, and it was listed as COVID-19 because they happened to test positive. And the other part of the question was, is there more money somehow being the motivator? Absolutely. The insurance companies and other folks actually pay more for a COVID-19 hospitalization than they do for anything else right now. And if you don't, and the reason for that, by the way, is because nobody had time to negotiate a rate. We're not going to put that out there, but the truth is, we have an ability to go ahead and shut this thing down. We don't need to be scared of it anymore. Okay. Before I close, let me let's talk about prophylaxis. I told you guys I use vitamin C and zinc. I would tell you right now, there's not a really good study that says hydroxychloroquine will actually prevent you from getting this. However, there is evidence in regards to folks in regions of the world that do take it for prophylaxis for malaria, like places like India, Bangladesh. And can you imagine what their rates of COVID-19 are? Yeah, basically almost none. And I think it's Bangladesh, if I'm not mistaken, only had 13 deaths this whole time.
Yes.
Okay, so there's something to this. Now, you guys saw the doctors that got on the steps of the Capitol, the frontline guys, and I think I'm going to be blessed with a phone call from the lady that led them, because I need a speaker for my conference. But yeah, so the bottom line is that these folks are absolutely right. And they're advocating for prophylaxis. As a director of an ambulance service well, I'll just say it, but again, I'm not here officially for them, in Mineral County, we have 4 ambulance crews for a 3,800 square mile county.
Wow.
If I lose a crew, I'm down 25% of my work team. We had a scare a couple of weeks ago where one of my crews, and they're all volunteers, by the way, 2 of my guys are in their 60s. I don't know how they ended up on the roster together. We're not going to go there. But they were transporting a patient from Lyon County here to Reno. And Reno typically pretty much swabs everybody when they walk in the door now. As my guys are halfway back to Hawthorne, they were calling him saying, these are 2 60-plus-year-old guys. One of them has another comorbid condition. And they're telling him, hey, this guy's been exposed, this guy's COVID positive. Not only did that trigger an alarm that I got a call up here that I had to take these 2 guys off my rotation, but then that was the same day that the governor's order expired. I tried to call the pharmacy down there. They wouldn't fill the prescription for me. Because the pharmacist is now arguing with me that there's no evidence of a post-exposure prophylaxis. No. And if I kept my mouth shut, I would just say, I think they have it, and they go, she might have given it. But the bottom line is, there's people that are going to be out there that are going to, unfortunately, I'll use something you said earlier, they drank the Kool-Aid. They're going to believe all the crap that's out there that's been said. We actually, in town here, have heard some pharmacists not willing to give it, and they're not even aware that the order expired. So when this thing expired, by the way, the pharmacy board made no announcement. Governor made no announcement. There's no announcement from anybody. It just expired quietly, and I had to put it out in the newsletter. At least some of the osteopathic physicians know that it's expired. And now that I'm getting a radio, I'm doing this event, hopefully getting this message out. But if you really want to look for proof of that, one, somebody can call the pharmacy board and they'll tell you it expired. They won't lie to you. It's on their website, but get this. You got to go to the website and then go under a little banner. It says COVID-19 information, and then go about halfway down the page. It is in bold type, but it's buried in the middle of all the other garbage. And it said the order's expired. So if you guys get a prescription for it and somebody's not willing to, they're saying, well, we can't dispense it, well, there's where you find it. And I think, Beverly, you have some of those copies, don't you?
I do.
Okay. So we'll give you a piece of paper that shows you. It's off the pharmacy board's website. Anyway, prophylaxis-wise, my guys are pushing me for it. I'm actually leaning towards doing it. And I think the way we're going to do it is kind of similar to what you guys used to do, Jim, is we do 400 milligrams once, and then so that's 2 pills, and then we do 1 pill maybe about every 3 to 5 days after that. And that's it. So I'm going to keep my guys safe. I'm maybe we can collect data that way. But anyway, so I'm sorry. Go ahead.
Wondering if there's any folklore in the medical community about President Trump's experiment with the drug. You mentioned he was taking it, and we never heard anything else about that.
Okay, so the question is, what are we thinking in the medical community about possibly President Trump taking the medication? In all honesty, there's been probably quite a few world leaders that have actually probably taken it, from what I've seen. And there's been a couple of governors, including this one, that there's rumors that that they've been taking it.
Yeah.
And again, those are rumors. I'm not going to say they're true or not. I don't have any proof of them, but there are quite a few people around the world that really swear by this, and besides doctors who are leaders. Brazil right now, the president of Brazil claims to have actually recovered, having one of those miraculous cures like overnight. He's really pushing for it, but he's struggling against the whole country. It's really poor and people not having access, so they're having a really rough time down there. So you keep them in your prayers, I would. But the bottom line is really, I got into this because, like I said, I've lost sleep every night knowing people are dying, and I'm going to do everything I can to get the word out. I'm not here to be a political advocate, but I'm here because everything I've been taught, Hippocratic Oath, and just about everything else that makes me who I am, tells me that this is wrong, and I'm supposed to, my job is to save lives, not just sit there. And I'm going to make one major statement here. Medicine's just basically been hijacked. And it's hijacked because back when I was in residency over 20 years ago, they were coming out with this concept called evidence-based medicine. So you got to have a study for everything. Okay, and then all of a sudden they're making it say, oh, not all evidence is the same. You got to have these parameters and that parameters. Yeah, I didn't get into medicine to become a research scientist, and a lot of the other doctors felt the same way. We're going to say, okay, you academic guys, you go and do this. We'll take your information and we'll apply it to our patients. Well, there's a difference between applying information and just being dictated by the information. Doctors now are dictated, and that's how they're trained. They said, okay, tell me what study or what protocol does this and that. When I was trained, we were trained to be critically thinking. Our job is to take all the information in, talk to our patients, and figure out what's the best course. And maybe I'm getting old, and that's old school, because it seemed foreign to some of the other doctors. Like I told you, some doctors don't even realize that there's 2 phases to this thing. I mean, I'm not even joking about that. It's really sad, because you're looking and you're seeing, oh, didn't all these studies disprove the hydroxychloroquine? I said, no, because it's not being used at the right time. What right time? And so, I mean, that's the kind of responses I could get from some people, and it's really sad. But as a president of a osteopathic medical association that advocates for doctors, we did this because one. So I'll tell you about a little bit of our arguments if you guys have a few minutes. When we filed the lawsuit, at a state level, there was a lot of stuff that they didn't do. They didn't do due process rights. The order apparently, most of the pharmacy board members apparently didn't even know about it, and 2 hours later they got an announcement they needed to show up at a meeting, and they voted it in. That's one. There was no time for anybody to workshop this thing. Nobody had a chance to input. I'm one of the groups that would actually normally input. We never had any notice. 2, At a federal level, you were asking me about off-label and stuff, so we did have that in our lawsuit. Any doctor can use any medication for whatever purpose, as long as it's explained and it's not doing overt harm, okay? This is one that, as a Christian, I cringe at, but we did use it as one of our arguments. There's an implied right in the 14th Amendment that whatever you and your doctor decide upon, as long as there's full consent, nobody can interfere with that privacy. Unfortunately, that was used in Roe versus Wade to justify abortion, but guess what, guys? If it works for abortion, it works for everything.
Yep.
Okay?
That's right.
So, well, being a Christian, I hope I don't offend anybody by spouting out a few verses here, but Romans 8:28 says, God makes all things happen for good for those that love him and are called to his purpose. We just took something bad and we turned it into a weapon against them. So, I just want to put out there that, you know, I'm really been honored to get in front of you guys, but I'm going to ask you, spread the word for us. People don't need to die from this anymore. We don't have to be afraid anymore. We need to get out there. We need to go back into our lives. I'll give you another example. I'm putting together a meeting in a month for the Osteopathic Association for Continuing Medical Education. I had to go through 4 psychiatrists to turn around and have somebody do a lecture for me about the psychiatric aspects of COVID-19, because 3 of the guys said that their political affiliations wouldn't let them do it. Okay, I'm just going to tell you that's out there. But anyway, I'm sorry. Go ahead.
Okay, so doctor, in my case, I have a family member that has, like COPD, was in the hospital in December with pneumonia and was on a ventilator back then. I've been, I would love to never wear a mask. I would love for that person not to wear a mask because he gets very crappy wearing a mask. But is he at high danger over he's in his 70s? What would we do to keep these more fragile people?
Okay. So the question is, somebody who has an older age and has comorbidities like chronic obstructive pulmonary disease, what do we need to do besides the mask? Well, okay, so the masks, they're going to help to some degree, but like I said, they're not 100% effective by any means. They're more there to make sure that you don't inherently drop extra stuff in there. But I'm going to tell you that, in my opinion, you're probably not doing a lot. But if you want an extra precaution, because in medicine we put on masks a lot of times just in the ER before we see a person, because it's universal precautions. Masks, gloves, gowns, and whatever. Whatever we can do to reduce transmission of stuff, we do that. That's fine. But in this kind of a situation, make sure you grab something that has my number on it. Call my office. I'd like to sit down for a few minutes. I don't want to violate anybody's privacy with their information here, but I would like to have maybe a quick 15-minute appointment. I'll go through everything I just talked about today, why I think it's good, certain risk factors, like any other doctor should do, and we'll assess together. More likely than not, for your dad, I would probably order him the medications in case he needs it, and then you guys promise me you talk to me before you start it. So I'll be there for you, okay?
Can you go over again how much zinc to take?
Okay, so for prophylaxis, you can probably do about 50 to 100 milligrams a day. In a treatment dose for zinc, in particular, you want 100 milligrams twice a day, is what the study shows, along with all the other stuff we talked about, hydroxychloroquine and azithromycin.
Thank you.
Yes?
Are local doctors resisting
Yes.
prescribing?
Yes,
Okay.
Renown will
Yes.
not prescribe it unless you're in the hospital. My doctor won't.
So,
And some pharmacies on filling it.
right. So the questions are, doctors and pharmacists, are they resisting doing this despite no order? The answer is yes, but some of them are out of ignorance. Some still believe in order. A lot of them believe in order still in place. Another part of it is that you've gotten all the poison Kool-Aid that you've been reading. And again, these are some of the doctors I mentioned, that they're not looking at the bigger picture. They're looking at this one aspect. Studies. That's what you're supposed to do. You're supposed to isolate one element and exclude all the other things. And do you guys know what percentage normally any study affects of the general population? It's actually at most 80%. It's never 100%. Let's talk about this. I'll get right back. I think it's me. I have some sort of personality that dreams this thing. I just think it just doesn't want me to sing karaoke. So I think that's what it is. Okay. Anyway, the bottom line is, when you're doing all your studies on less than 5% of the people that actually get all this, in fact, probably more like 1% of the people that get this, how does that apply to the other 95 to 99% of the population? It does not. And so that's what I'm trying to let these guys know, is that, dude, take off the blinders, step back for a second and take a look at the whole thing. You're missing, I'm sorry, using cliches, missing the whole forest for the trees. Okay.
Common sense.
Common sense is a good thing. So again, that's why I would say that there's all this resistance to it. Plus, there's been an active campaign to put other medications out there. Some of them are working, but they're a hell of a lot more expensive. I'm sorry,
I
go
guess
ahead.
what I was leading to also is if there is resistance about even prescribing it, much less getting it filled, if you feel like you're coming down with it, what should we do? Call you?
Call Dr. Fong.
I guess, yeah, you can call. If you guys feel like you're having problems, give me a call. My office will set you up for like a quick phone appointment, because I own a center that does a lot of infusions. So I got to take care of those people, and we'll look out for them too. So I would want to evaluate you on the phone before I have you come down. But if I think that you're at risk, like I was telling her, I potentially could call it in for you. And if we have a lot of people being resistant to filling it in regards to the pharmacist, I work with an out-of-state mail-order pharmacy that they could overnight it to you if you really need it that quickly. So we have, I do have a source and a means to do this.
Okay, thank you.
Yes, ma'am.
Is this an expensive drug, and does the insurance companies all cover it?
I'm so glad you asked that, because I totally forgot to mention that. So when this all started back in March, before the governor put the order in place, I actually treated a few people. My cost, I'm one of the few doctors, by the way, that has a pharmacy dispensing license, because I was doing natural thyroid, and I was worried they were going to make supplements into something you needed a prescription for. So I was going to be ahead of the game. Back then, I was actually friendly with the pharmacy board. So it's scary. But anyway, the bottom line is that when I went to buy supply bottles, which the ban went into place the day that I wanted to go buy the supply bottles, the cost per pill was 30 cents. Okay, so again, we're going to talk about this with the therapy we just talked about. If we just talked about hydroxychloroquine and the azithromycin, I think it's about, if you paid cash, it's about $100 for the entire treatment course. One dose of remdesivir, which is the other major antiviral they're using, it's about $1,200 to $1,300 per dose, and then you require 6 doses. So you guys do the math on that one.
Oh, wow.
So, I'm sorry, go
I
ahead.
just wanted to mention something about the cost, because I actually dealt with your out-of-state pharmacy yesterday. And you might not be aware of this, but they accept RX, which is one of those free discount prescriptions. So the cost was actually $36.
Oh, wow.
So comment was, I called her in a prescription, and basically it's a pharmacy in Michigan, and they apparently do take these Good RX and other discount assistance programs, and they got the, because they were telling me if you got the zinc, it was going to be close to $130 or $140.
Without the zinc.
Without,
That's
okay.
a special zinc
Yeah.
you have.
Right.
Z-Pack.
Okay. So, yeah, that's perfect. So it knocked out 2/3 of the cost, basically.
Doctor, we might have time for maybe one more question or so, a couple more.
Sure. Okay, so I guess they're noticing the Asian thing. They want to go sing, so they're limiting me a couple more questions. So yes, go ahead.
Real quickly, you said that there is a treatment window, and exactly what is that treatment window?
So again, the treatment window really is sort of individualized, but when somebody for me, it's if somebody comes down with symptoms, within the first 3 to 5 days, if they're getting better, I'm probably not going to treat them. But if they're not getting better very quickly, or they're getting worse, or and worse meaning like within a day or two, they're significantly worse, we might do it. And especially if they have comorbidities, either over 60, having other conditions, that affects my decision. But the therapeutic window, strictly time-wise, is you watch them for a few days. If they don't get better, you treat them before they start getting really bad. Yes?
Your radio show, What day, what time, what station?
Okay, well, I don't have a radio show, but I've appeared on Dr. Forsythe's show. Well, actually, I'll let Dr. Forsythe answer, actually.
It's called Health Matters. It's on 1180 at 3:30, 3 to 4, excuse me, 3 to 4. My wife also has a program called, it's a Bible study program which goes all over the world on Revelations. And she was formerly the head of the Nevada Republican Party in 2004 when we got George Bush, and that was the last time Nevada went red.
Good.
So let's give Erlene Forsythe, my wife, a hand.
Thanks. So again, that's 11:80 a.m. on Wednesdays, 3 to 4 o'clock with Health Matters with Dr. Forsythe. And I've been on with Kelly Rush's show, which is also on Wednesdays at 5. I think it's 5 to 6.
Have you been on Monica J's show?
I have not been on Monica J's show.
She wants to talk.
Okay.
It's time.
Okay.
I
So,
just want to make
yes,
one
We'll
comment.
keep you busy.
I'm a psychiatrist,
Yes.
and yes, we use medicines off-label all the time. For instance, treating anxiety, we use everything from blood pressure medicines to antipsychotics. The QT prolongation, a lot of psychiatric meds cause QT prolongation, and I think they talk about that one because it's scary sounding. Oh my gosh. If you don't have some kind of pre-existing cardiac condition, I've never had a single person, and I've used gigantic doses of some of these medicines that cause QT prolongation. I've never had a single person have a cardiac issue from that. And I think the media is just using that point to scare people.
Absolutely.
So that even if they have a physician willing to do it, they'll be afraid to do it.
Thinking twice. So Dr.
Tori
here, she's a psychiatrist. She's used a lot of medications in her practice that can do that heart arrhythmia thing where they prolong the electrical rhythm and you get the arrhythmia from it. She has never seen any side effects despite using high doses of that, and I would tend to concur with you. When I actually interview a patient with this, just because of all the swirling stuff, just to kind of mitigate potential exposure, I actually ask questions about if you have had skipping heartbeats, if you've ever wanted to pass out, you know, anything that's related to the heart, maybe not necessarily chest pain because that's totally different, but any of those things, it might trigger me to use an alternative to azithromycin, and that's doxycycline. So I would actually use doxycycline 100 milligrams twice a day for the 5 days instead of the azithromycin. So the azithromycin and the hydroxychloroquine could, and we again, little c, right? Little c could actually cause this problem, but it's really unlikely. But if you have somebody that you're talking to, so again, I'm talking like I'm talking to doctors, but my advice is just to kind of use and doxycycline's been used instead of azithromycin, which does not do that. So there is an alternative to that if we needed it, but I pretty rarely needed to switch things around. Well, guys, thank you very much.